Hello, this is Dr. Steele. Today I want to talk to you about the most common causes of death, especially here in the United States. One of the main ones that we always hear about is cardiovascular disease, heart attacks. That is the why I tell my patients, especially because I deal with a lot of patients with diabetes and take care of them, is that in the event that they feel shortness of breath, they cannot speak in full sentences, then with pain or without pain, it is important to go to the ER to get evaluated. And another way to remember, another thing that you need to remember as well is that sometimes I have had patients that the only thing they feel is very anxious. They feel like something is not right. Of course, we need to do an EKG and we need to evaluate that to be able to come up with the answer of a heart attack. So it's very important for you to have a very high level suspicion when you are getting older, especially if you're a man, but women too after menopause. Now, the other one that I also wanted to remember, the second cause of death that is very common is, as you know, brain attacks, strokes. And strokes, the minute you start feeling not necessarily numbness, I want more motor function deficits, like I cannot speak right, or I cannot move my arm. Something's off, right? Motor function deficit, acute. Immediately go to the ER to get evaluated and treated. The other one, cause of death that is very common as well as we get older, is cancer. And cancer sometimes is very challenging to diagnose, especially in parts of our body that we don't screen for. Because you heard that we screen for colon cancer, you heard that we screen for breast cancer, also cervical cancer, now lung cancer. We do a CT scan looking for cancer in patients that have a history of smoking, and colonoscopies and so on and so forth for colon cancer. But we don't have tests for all cancers. We don't screen for all of them. But we don't have a good test for pancreatic cancer. We don't have a good test for biliary cancer, et cetera, et cetera. So it's important to listen to our body. We need to feel symptoms. If we feel the symptoms or the signs, we see something or see something or feel something, we need to talk to our doctor. And it's important to remember the following. If you ever, hopefully never, feel like you have lumps or bumps in the anterior part of your body, especially your neck area, your breast, even men, axillary areas, belly, inguinal areas, and of course in men, testicle. It feels hard like a rock, more than one, we need to seek medical attention to get that evaluated. Another sign and symptom is bleeding from any orifice, coughing blood, pooping blood, peeing blood, and it's not going away. It's been happening for a few days. We need to get that checked. Another one is losing weight very rapidly, and we don't have a reason. And also, we're not hungry anymore. We need to look for something. Also, if patients have, the white part of the eye turns yellow, icterus, like hepatitis, we need to look into that as well, even though there's no pain. Also, remember, skin changes. Ulcers that don't want to heal, birthmarks that look weird, stains that look weird, we need to look into that. And of course, pain that is backwards. You know how pain tends to get better with time, but when you have a cancer, sometimes it tends to get worse with time, most often. So like headaches, back pain, belly pain, it continues to get worse, the pain, we need to look for something. We need to look for why is this happening. Now, another reason that we die as we get older, which is very common, are infections, especially pulmonary infections. That's why we made a big deal with COVID and, of course, the flu, and we want patients to get the vaccine because that's one of the main primary problems with dying, lung infections. So it's important to realize that if you have fever and chills, it's time to go to the hospital, not just wait until Monday to talk to the doctor. And I'm saying that because sometimes we want to wait until Monday. And I want you to identify things before that happens, before you start thinking that way. It's like, let's say your garage was on fire and you tell your wife or your husband, oh, I'm going to wait till Monday to see if the fire is still there or if the rest of the house is not being affected by the fire. So it's important to seek medical attention, as I said before. And the last thing that I see all the time as we get older are neurodegenerative changes. And you heard on the news, celebrities having Parkinson, uh, Alzheimer's, and other neurological deficits. That's another reason for us as we get older to die more often. And lastly, and most importantly, is falling. If we fall, we break. So it's not like before when we were kids that we broke something or injured something and we heal quite rapidly. As we get older, after 50, which I'm there, we're healed more slowly. So it's important not to be lifting, pushing, climbing, or lifting anything after 50 because we tend to injure ourselves and then we have chronic pain and we cannot move. If we cannot move, let's say you break your hip, that's another reason why people die sooner, because remember, without movement, your circulation cannot work correctly, and that leads to a lot of problems as we get older. Well, that's my talk for today. I just want you to remember the most common reasons why people die. So we need to take the steps to minimize the risk of us dying, because our goal is to prolong life and delay complications as much as we can, knowing that we're not eternal, we're still gonna go. But for me, another day, another month, another week, another month, another year, or 10 years being here, especially if you have loved ones to take care of, is very important. Talk to you soon, and remember,